Hi everyone, I'm Michelle Coombs. I'm a physical therapist. Today we're going to be talking about the ankle dorsiflexion knee to wall test. This is a simple clinical test that looks at weight-bearing dorsiflexion range of motion. So it's a very functional position. We use it for a few things. We use it, one, to measure improvement in ankle dorsiflexion range of motion. We also use it to identify any restrictions. And third, we can also use it to differentiate between joint restrictions and soft tissue restrictions or limitations. So why is ankle dorsiflexion even important? Well, we use it for walking, jogging, going up and down stairs. Many things that we do in our life require enough range of motion at our ankle. When we're walking, our normal gait pattern requires about 10 to 15 degrees of dorsiflexion. For jogging, stairs, and other activities, we need even more. Now, if you don't have enough ankle dorsiflexion range of motion, it can be problematic. Some researchers say that this is actually a dangerous factor for lower extremity injuries. We also have decreased efficiency in our forward progression, and we do have altered movements in our lower extremity, and this causes compensation, which tends to shift stress elsewhere in our body, and for some people, this can lead to an injury. Let's go over how to perform the knee to wall test.
So this is a demonstration of the knee to wall test. So I put a piece of tape here to mark off 10 centimeters from the wall. The 10 centimeter mark is actually the front of the tape. So what I'm going to do is I'm going to be facing the wall with one foot in front of the other. My back knee is actually on the floor, as you can see. And my front foot, I'm going to be lining up my toe, my big toe, with that 10 centimeter mark. And what I want to do is I want my knee to go straight toward the wall over my second toe. So I don't want it to be going inward. I don't want it to be going outward. Those are compensations. What I want is for it to be going straight over the big toe and seeing how close I can get to the wall while keeping my heel completely in contact with the floor. Okay, so as you can see, I'm not quite there. I actually have a little bit ways to go. Now let's compare it to my other foot. I'm going to again line it up. Okay, and I'm going to try and go straight toward the wall over my big toe. And as you can see, my heel is still in contact with the floor, but I'm actually quite a bit closer on this side. Okay, so I can actually use a little bit of work on my right ankle.
The normative values for most adults is that they should be able to touch their knee to the wall if their foot is 10 to 15 centimeters away from the wall. Now, we do have to keep in mind some factors. Everyone's body proportions are a little different, and that can play a part in the result. This test also will help us differentiate between joint restriction and soft tissue restriction. So if when you're doing this test, you're feeling more of a block or even a pinching sensation at the front of your ankle joint, that tells us that it may be more related to a joint restriction. Maybe the joint does not have enough mobility or range of motion. If you're feeling more of a stretch in the back, kind of like near your Achilles tendon or in your calf muscle, then it may be more likely it's a soft tissue restriction, maybe a tight muscle. Stay tuned for a future video that I'll make just for treatments on joint restriction and soft tissue restriction in the ankle area. This is a really short video. That's all for today. I hope you liked it. If you did, like and subscribe. See you next time.